and thank you for taking the time to watch our Salute to Nurses Heart of Healthcare video package. Each year we ask our readers to submit nominations for Nurse of the Year and top 10 nurses in our area. The nominations have been overwhelming, as this is our 4th year of the event. Our panel of judges had a very difficult time selecting the top 10 nurses as well as Nurse of the Year. I'd like to take a second to thank our judges, Tim Kotnauer from State Bank Financial, Joanne Sandvik from UW-La Crosse Medical Science Health Consortium, and Ryan Smith from Dahl Automotive. Of course, our Salute to Nurses Heart of Healthcare event would not be possible without the generous support of our sponsors. Our presenting sponsors, Viterbo University and Mayo Clinic Health Systems. In addition, our supporting sponsors, Vernon Memorial Healthcare and Dahl Automotive. So enjoy our video package that we've put together that spotlights our 10 nurses of the year, our 10 top nurses, as well as our Nurse of the Year and our Salute to Nurses Heart of Healthcare. Thank you to our nurses who serve as a great reminder of the world-class health systems that we have in the Coulee region. Thank you.
Hello, I am Lisa Archer, Chief Nursing Officer for Mayo Clinic Health System in La Crosse. As Nurses Week commences, I would like to take this opportunity to express my gratitude and recognize you for all of the extraordinary work that you have done to serve our patients, communities, and each other. On behalf of Mayo Clinic Health System, our patients and communities, I wish to explicitly say thank you for your perseverance, compassion, and excellent patient care. We are proud of you for leading our communities during the COVID-19 pandemic and beyond. You have made a significant impact on the lives of our patients and have done so with the highest level of compassion, professionalism, and grace. We are extremely grateful for you and all that you have done to provide extraordinary care during some of the most challenging times we've ever faced. So happy Nurses Week. We celebrate you and all that you do for our patients. Thank you again. It's an honor and a privilege to work with each of you.
I've always been drawn to the maternity and newborn population. My mom had great experiences in her labor and delivery time, so she told me all about that. I job shadowed in an OB clinic, fell in love with that population even more, had an internship here on this unit, and ended up falling in love even more and came here right after graduation. I'm just very honored and humbled by the nomination, and I'm very thankful for my coworkers who pushed me to go above and beyond.
One of the most rewarding things is being able to help people. You get a lot of the same kind of patients from our community throughout the years, and it's nice that you help them, reassure them, and then see them again out in the community. They always look forward to seeing you when you know, if they were to come back into the hospital and having the same nurses. So that's one of the things that's most fulfilling to me. It's a kind of a surprise to me. I was on vacation and my supervisor called me while I was on vacation and told me that I was nominated. It was pretty heartwarming to know that somebody felt like you were a good nurse, caring nurse to be nominated.
Well, first of all, thank you, Pete, for the nomination. I do impact patient care in a different way. I'm not at the bedside. However, it's my job to ensure that the nursing staff have adequate staffing, that they have the tools and the equipment that they need to provide excellent patient care. It's my job to monitor safety and quality, again, to provide the safest and best care here at Vernon Memorial. Surprised, humbled. I'm not one to be in the forefront. I very much want to support the team, and the team is of nurses are the ones that are providing the direct patient care and deserve the thank you. It's been a hard couple of years with COVID, and our team has done a great job of caring for our community.
You know, I'm a case manager, so my role is pretty flexible. I work with all of the surgeon's patients, so I work with multiple different types of patients, but a major part of my role is patient education. With COVID, you know, there was a lot of restrictions on how many people we could have together. I used to teach a class about people having hip and knee replacement surgery. And we'd have a group of patients, but since COVID we've had to change some things. It helped us accelerate some of the things that we had wanted to change over the years. It kind of made things happen a little quicker. So now I am doing virtual total joint classes with patients, and I can do groups or I can do it individually. And those people having that surgery, it's worked out really well because they have a difficult time walking, getting to the clinic. So they can stay in their own home, they can stay in their pajamas if they want, and their family can join from other places. A lot of them have kids out of state, so they can even join the class virtually and know what's going on and ask the questions that they have. I was really shocked when I got the call. Actually, I thought he was calling me about something else, so it really caught me off guard. When I know who the patient is, that has nominated me, I almost feel like I should be giving them the award because, I'm just doing the things that I love to do. And I truly meet the most amazing people, patients and families. And, if I can do anything to make, a small part of their day better or their experience better, that's enough for me. So, I think there's a lot of nurses out there that could enjoy, deserve this award more than I do. But I really appreciate that there's some recognition for what nurses do, because it is a difficult job.
One of the most rewarding is watching people get better, overcome obstacles, or helping them die with dignity. I'm on 7th and I'm a charge nurse on 7th, and so I kind of run the unit a little bit when the manager's not there. And 7th Medical is a family. They're not just coworkers, they're a family. We all work together to get the job done, and it's kind of nice to be able to be the leader of that group and know that they're doing such a wonderful job.
Well, I work in the ICU, and it can be hectic or busy at times, but it's one of the areas of nursing that you get to spend a lot of time with patients. And nurses work best in a team, and I've been lucky enough to work with a really, really good team. A lot of the doctors, other nurses, the techs, and a lot of the other staff that come into the unit. They really made, I think, ICU nursing enjoyable for me, really rewarding. I'm overwhelmed. It doesn't really feel like, it doesn't really seem to me like I'm necessarily doing anything else that any other nurse doesn't do. I actually thought it was an April Fool's joke. I had to call my boss to verify.
Funny.
But, I've been lucky enough to work with some really great nurses, learn from a lot of great nurses, and I think I feel really lucky to have been able to be a nurse and to work with people.
So I began my nursing career at Gunderson. I started as a float nurse back in 2004, and then in 2010 I became one of the first clinical nurse leaders at Gunderson Health System. Nationally, it is still an emerging role, and at this point in time I think there's only about 9,000 in the country. So at Gunderson, it's really exciting to say that I'm about one of 15 people here at Gunderson that's actively working in this position. So what makes it unique is that this type of role allows me to stay at the bedside. I get to work side by side with patients as well as other nurses and the whole interdisciplinary team and take care of patients. Interestingly, my title says that I'm a nurse leader, but I don't manage, I partner. I think my favorite days are when I get to roll up my sleeves and work side by side with the nurses. And especially be with them during challenging situations or things that they're just not certain of how to work through. So I am thrilled just because as a nurse leader, a clinical nurse leader, I think that it solidifies my purpose. I want to be able to lead people, lead outcomes, and have patients that have success in their journey while they're here with us in the hospital.
So a lot of my job lately has been with COVID-19, and that certainly has been with everybody's job lately over the last few years. Surveillance is a lot of it, rounding, pitch hitting where people have questions or concerns. If people have questions about whether they need to be using what personal protective equipment, or if they have questions about cleaning or hand hygiene, those are kind of some of the things I get involved with. And eyes on, observing when I'm doing rounds. Are there things that maybe we can improve upon? And just generally available to the staff if they have questions or concerns. I think the most rewarding thing about the work is that you actually can help people. You can answer questions and a lot of times alleviate a lot of discomfort or anxiety that people have. Certainly with COVID, there's been a lot of that, and not just staff included. I think everybody's had that. So I think that's been most rewarding, is to help people. I am just really humbled and amazed. I think that there are a lot of candidates that have been nominated here, and I think they're very worthy of it. I have worked with some of these people, and they're very outstanding and very, very worthy of the nomination. I think I'm just a little piece on the totem pole here, so I think there are others that are more worthy and certainly have worked hard during the last few years with COVID.
Thank you so much for coming to see me. You know, I work the medical surgical unit here. That's my home base. That's what I know and love. Take care of, you know, anybody from pediatrics, different populations like the Amish, elderly people, infections, wound care, all the things. So that definitely is different than other areas of the hospital like surgery or the emergency department or obstetrics with the baby stuff, but we do really see a little bit of everything, which is pretty unique. Oh, just seeing the good outcomes of our patients. Yeah. You don't always see that. Working in other departments, you know, especially on the surgical side of things that I do, they come in, they have their knee replaced, they feel better, they go home. That's really, really rewarding for me, and people that are happy to be here, happy for their care, and happy to feel better and go home again. Oh, sure, I was a little bit nervously excited when I heard the news, and Kaylee is, you know, a dear friend now. She's come through my orientation program. We work on the same weekend together. So we've become very close in all of the struggles through everything with COVID. And now as the world is slowly getting back to normal, I'm very excited. I'm very, very lucky to be here, be a part of the team at VMH, and just get to experience serving our community together.
I am a float nurse at Mayo here. I work on all of the floors, and I work in the ER as well as in Sparta. I've worked on every floor this past month and the ER. I've felt very honored and very surprised.
How come? What you did? Like,
I had no idea.
You had no idea it was coming.
Yeah.
Yeah. Do you feel like self-conscious about it, or like with your coworkers and stuff, or you just kind of
go with the flow?
With the flow.
Yep, that's the type of person I am. Go with the flow. That's why floating is great for me. Yeah.
Well, Chelsea, congratulations, and thank you for talking with us.
Thank you.